On this Sunday night, the police investigation into a Quebec care home. The cases of COVID piled up at the long-term care facility.
This is why we've characterized these homes as tinderboxes.
With no warnings to the families. Trump's plan to get America back to business.
We're winning the war.
But are lives at risk with worries about a second wave of the virus? Boris Johnson out of hospital. But the British Prime Minister hasn't bounced back from COVID just yet. And doing Easter differently.
Amazing grace.
The holy streams for the flock.
Global National with Robin Gill.
Good evening and thank you for joining us. We begin tonight with developments from that care home in Quebec where 31 people died in less than a month. At least 5 of them had COVID-19. The provincial coroner's office announced it will investigate the fatalities. That's in addition to investigations by Quebec's health department and police. As authorities look for answers, families are demanding to know how their loved ones could be left in such deplorable conditions. Michael Couture reports.
Kira Whitehead spent her Easter Sunday outside the Heron residence looking for answers. She knows her 89-year-old father had COVID-19 and died here on Friday. But that's all the information she's been given.
I feel worse because I don't know if my dad was lying in feces or not. I don't know. I don't know anything. I haven't seen him.
Few have seen the inside of the residence where 31 seniors have died in less than a month. The Major Crimes Unit of the Montreal Police Force is now investigating, as is Quebec's coroner.
We're collecting also documents that we're seizing, notably stuff like work schedule, list of employees, different types of evidence.
Police say the investigation could take weeks or even months. Quebec's Premier François Legault has described it as a possible case of gross negligence, with reports of residents being left in beds of their own excrement. Despite those difficult conditions, social worker Mandy Novak felt she had to come to volunteer her help.
There's a smell in there, and it's a smell of the deceased and of wounds that need to be taken care of and were not taken care of for a long time.
The province has said at least 5 of the 31 deaths inside the home were linked to COVID-19. The number of Canadian long-term care homes that have been ravaged by the virus continues to rise. Hundreds of facilities across the country have been hit by outbreaks, with elderly populations being more susceptible to the virus.
This is why we've characterized these homes as tinderboxes.
Dr. Samir Sinha helped the federal government develop recently released national guidelines for long-term care facilities to protect them from outbreaks with a so-called iron ring. Procedures like preventing people from working in multiple homes and making sure both staff and residents wear masks.
When we are having a case appear in a home, that we're actually promptly not only testing and isolating those who look like they're symptomatic, but also recognizing that people could have been infected who are asymptomatic.
Dr. Sinha acknowledges having those guidelines in place a month ago could have saved lives, but he says having them in place now will save many others. Michael Couture, Global News, Ottawa.
Quebec has been hit the hardest by COVID-19. The province now has more than 12,000 cases and 328 deaths. Overall, Canada has more than 24,000 cases. COVID-19 has claimed more than 700 lives in this country. For the first time in history, every U.S. state is under a disaster declaration. There are more than 550,000 confirmed cases of COVID-19 in the U.S. At least 21,000 people have died. The U.S. has suffered more COVID-19 deaths than any other country in the world. And as Jennifer Johnson explains, there's concern more Americans could die if President Trump reopens the economy too soon.
A nation praying for hope this Easter Sunday, in some cases through video. In a handful of states, worshipers ignored health experts and congregated in churches.
This Easter will be much different than others.
In his Easter address, U.S. President Donald Trump promised America will soon get back to normal, despite COVID-19 infection and death rates still on the rise.
It's a plague on our country like nobody's ever seen. but we're winning the battle, we're winning the war.
This week, the president plans to meet with his new task force on reopening the economy with the targeted May 1st date. Already his own health experts are pushing back, saying they still don't have the right diagnostic tests to protect people.
This team of experts, all of government approach, they're focused at looking at the earliest possible time that we can get Americans back to work safely and to give Americans the confidence they need.
World health experts also urging caution.
We think it's going to be a virus that stalks the human race for quite a long time to come until we can all have a vaccine that will protect us.
The nation's top infectious disease expert now admits concerns about the economy led the U.S. to wait too long, mid-March, to order protective measures to stop the spread of the virus.
Obviously, if we had, right from the very beginning, shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back then.
As the virus keeps tens of millions of Americans out of work, food banks are stretched to their limits. People waited in their cars for 2 hours at this distribution site in Hawaii.
I've never seen anything like it, but I don't think America has ever seen anything like the COVID crisis that we're having right now. This is extraordinary.
Meanwhile, the Treasury Department says tens of millions of Americans will start receiving their coronavirus stimulus payments next week. Some hope on this Easter Sunday for millions suffering from this pandemic. Jennifer Johnson, Global News, Washington.
The global toll of this pernicious virus is staggering. There are more than 1.8 million confirmed cases of COVID-19 worldwide, and more than 113,000 people have died from COVID. Right now, the UK is being hit extremely hard, recording more than 700 new deaths of COVID-19 in a 24-hour time frame. That takes the total number of deaths there to over 10,000. But there is some hope in Spain. The rate of infection has fallen. Still, that country recorded 619 deaths in the last day. British Prime Minister Boris Johnson is out of hospital, but he won't be rushing back to work.
I've today left hospital after a week in which the NHS has saved my life, no question.
The 55-year-old says his life was on the line with COVID-19, and the situation could have gone either way if it wasn't for frontline health workers. Johnson was rushed to intensive care on Monday and spent 3 nights in ICU receiving oxygen. Pope Francis delivered Easter Sunday Mass in a near-empty St. Peter's Basilica as churches grapple with celebrating one of the holiest days of the year in a time when physical distancing is a matter of life and death. The pontiff says the pandemic is testing our whole human family and that this is not a time for self-centeredness and division. Only a handful of people were inside the basilica to assist with a virtual service for worshippers to watch from home. It's in stark comparison to last year, when some 70,000 people filled St. Peter's Square for the service. Italy is one of the worst-hit countries in the COVID-19 pandemic, and the religious community has not been spared from the devastation. According to the New York Times, at least 100 priests in Italy have died since the outbreak hit that country.
When we come out of this, and we will come out of this, we will all take pride in the sacrifices we've made to protect each other and to protect the country we love.
Prime Minister Justin Trudeau thanked Canadians for doing their part to prevent the spread of COVID-19 by keeping up their physical distance this Easter. He also offered words of support for the healthcare workers on the front lines of the pandemic during a holiday weekend for so many cultures, including Passover, Tamil New Year, and the Sikh holiday Vaisakhi. Easter Sunday services across Canada took on a much different look this year, with religious leaders addressing congregations via live streams. It's a way of navigating the difficult balance of keeping tradition and practicing physical distancing, so necessary to protect our communities from COVID-19. Global's Joe Scarpelli shows us how churches are adapting in these trying times.
You'd never guess it was Easter Sunday, judging by the parking lot of this Winnipeg church.
Better is the thing that we can look at.
But there is a service happening inside.
I don't think anybody's seen an Easter like this before. But I think the church has learned to adapt and has adapted very well.
For the first time, Pastor Jerry Michalski is live streaming his Easter service to an empty building. Families around the city tuning in from home.
Kev's drinking his coffee. We're watching church on the big screen there.
Similar celebrations taking place around the country. A church in Saskatoon with its first ever virtual Easter choir. It took 70 hours to stitch together 40 videos of the people singing their parts. And this Toronto family is adapting their festivities to suit the times. A virtual Easter this year for an 82-year-old grandmother who hasn't missed an Easter Sunday Mass in her life.
I feel sad because I don't see nobody in the church.
We had our cousins kind of come through the back and just stand outside the door and just gave our Easter wishes to each other. And that was obviously different and hard.
Welcome to our venue.
In Calgary, one church going drive-in movie style for its service. Cars packing the parking lot, tuning into their radios, and watching the pastor on the big screen.
It would be a record attendance for us, like for sure on any day. Probably times 1.5 or 2. So yeah, it's been busy for us.
A different but unforgettable Easter. Joel Scarpelli, Global News, Winnipeg.
No outings, no gatherings, no groceries without lineups. And for many, no prospect of work for months. What has become normal is anything but. Life under COVID-19 is the focus of a new primetime program by Global News. It's called The New Reality. It airs every Sunday at 7 p.m. and it's hosted by Donna Friesen. Hi, Donna. Tell us what The New Reality is all about.
Well, Robin, we know everyone's living with uncertainty right now. This mysterious virus is lurking. There's anxiety about paying the bills, and it's really hard to make any plans for the future. And we have to stay physically distant from people. Everyone wants to know, of course, is this the new reality? Well, no one has the answer right now, but every week we're going to keep asking the question.
And who are you talking to this week?
Well, one of the people is Dr. Bonnie Henry. She's BC's public health officer. She, like all the other public health officers in Canada, is front and center right now. She's been giving almost daily briefings for, I think, 12 weeks. People absolutely love her. I asked her, among other things, how much it weighs on her to strike the right balance between giving people the facts and not panicking them.
Everything about this has been so challenging, and the sort of balance of trying to get just enough restriction to do what we need to do, but not too much. And it haunts me a little bit because you can't ever get it just right.
We also talked to an ER doctor about what happens to people if they end up in the ICU. And we have a sampling of all that crazy, funny stuff people are putting on social media, people who have obviously way too much time on their hands. Robin?
Thanks for that, Donna. We'll all be watching, and you can watch The New Reality starting tonight and every Sunday at 7 p.m. right here on Global. Coming up, down the drain, the pandemic forces dairy farmers across Canada to spill their milk. Dairy farmers are the latest to be forced to change tactics because of the pandemic. Producers are stuck with milk normally sold to businesses that are now closed. And as Eric Sorensen reports, they're forced to dump their milk to control the supply.
From this farm in Wisconsin to the UK to Canada, one of the sad consequences of the pandemic has been the dumping of millions of liters of raw milk. At first, there was a milk shortage as some people hoarded. But the real impact hit when restaurants and other retailers shut down.
Food service sector curtailed significantly. Raw milk that comes from cows is very perishable.
Producers say they can't turn off the cows when demand is suddenly wiped out for a product sensitive to balanced production. So Dairy Farmers of Ontario told 3,400 producers this week to dispose of their milk on a rotating basis. Other provinces are doing the same.
The last thing a farmer wants to do is dispose of milk on the farm.
But for some, dumping milk, however rare, raises questions about Canada's scheme of fixed milk prices. For many products, from gasoline to perishables like vegetables, an overabundance leads to a drop in prices, and then consumers buy more of that product for a time. That's not quite how it works for milk, in part because it is governed by the supply management system, which keeps prices stable.
Dairy farmers make a profit, a guaranteed profit.
Sylvain Charlebois says under supply management, milk prices are set and farmers, based on quota, will get paid. Allowing an excess of milk at lower costs into the marketplace is not part of the formula.
Right now, producers don't have any incentive to change because they're paid for the milk they're dumping.
Dairy farmers say supply management is necessary to ensure a safe supply of milk on store shelves that Canadians can rely on.
The prices are a fair return for farmers, which allows us to be sustainable.
But disposing of milk, as on this British farm this week, is a disquieting image during a time when food supply is front of mind. Sylvain Charlebois says in this country, milk dumping should be banned to incentivize farmers to find a better way to market milk.
And it needs to be addressed because these situations will happen again.
In BC this week, producers disposed of 3% of their production. Dairy farmer Nick Janssens doesn't want to dismantle supply management, but he's also dreading a possible call to dump some of his milk.
To dump perfectly good product that you've produced, that'll be definitely not a good feeling, and I don't look forward to that day if it does come.
Eric Sorensen, Global News, Toronto.
Still ahead, why lack of support for developing nations in this pandemic can endanger us all. COVID-19 is now spreading to developing nations, which remain underprepared and underfunded. As Redmond Shannon reports, if the world's poorest countries fail to tackle the pandemic, it could cost us all.
The diplomatic spat between Canada and the US over face mask exports has been just one example of how the world has been reacting to COVID-19.
3M has not treated our country well. And if they do, great. And if they don't, they're going to have a hell of a price to pay.
The desire to close down borders and look after your own people is natural and understandable in a pandemic. The European Union and others have also moved to limit some exports of medical equipment. But from the very start, the WHO has stressed the need for the world to work together.
This problem can only be solved with international cooperation and international solidarity. When health workers are at risk, we're all at risk.
And the reasoning is simple. If COVID-19 is not eliminated everywhere, then it will return everywhere.
One of the critical issues that we're working on globally is to have people understand this is truly a global problem. Nothing tells it like this disease, which started around Wuhan, but in 3.5 months moved to more than 180 countries.
Dr. Seth Berkley is from the charity Gavi Alliance. It has helped vaccinate hundreds of millions of children against diseases like cholera, measles and Ebola. He says the worldwide lockdown is already indirectly threatening people at risk from those diseases, as well as efforts to tackle COVID-19.
We also have 21 countries who are beginning to become short of vaccine supply, and the normal supply has been disrupted because of airline, stopping flights to those countries or closures.
Healthcare systems across the developing world struggle to get medical supplies at the best of times. The World Bank says it will provide more than $200 billion of loans to those nations over the next 15 months. But the money will only be of use if they can use it to buy the right equipment from industrialised nations. If they can't, then COVID-19 will remain a threat for everyone. Redmond Shannon, Global News, London.
Up next, how can a former Bronco heal in this pandemic?
We're part of Terry's family, and we're honoring the 40th anniversary of the Marathon of Hope.
Terry Fox's family continues his Marathon of Hope, which began 40 years ago. The 21-year-old died before he could complete his journey, but he raised more than $24 million for cancer research. The Terry Fox Foundation has raised hundreds of millions of dollars since. It's been 2 years since the Humboldt Broncos bus crash. 16 people died, and players like Ryan Straschnitzki suffered serious injuries. He was paralyzed, but now COVID-19 is impacting his rehabilitation. Here's Heather Yerkes-West.
For Ryan Straschnitzki, getting back on the ice with teammates means everything. A chance to recover something lost. But because of COVID-19, those opportunities are gone once again.
I was on the ice about 4 or 5 times a week and unfortunately stopped about just over a month ago.
Before the pandemic, Ryan had been preparing for a national tournament with his provincial sledge hockey team and experiencing gradual improvements after receiving a spinal stimulation in Thailand late last year.
It's been steady progress. I was in about 4 times a week as well, and it was all walking for about hours, and it was constant work, and it's hard, but it's getting way better.
Last week, those physio appointments ended as well.
It's unfortunate, and we certainly understand why, but it's taking a toll on him mentally more than anything else.
It gave him something to do and something to look forward to get out of the house. So now he works out just in the basement.
Coming from an athletic background, you're always constantly moving 4 or 5 times a week, or even 6 days a week, and to have that all stopped and shut down is tough. So kind of got to keep active at home as much as you can, and keep your mental and physical health up to par.
But the family of 6 is also counting their blessings. For a year after the bus crash, the family lived in separate rooms at a local hotel while their home was renovated to accommodate Ryan's needs. All under one roof again. They're trying to use this time to reconnect.
We've been doing a lot of Netflix and laughing and spending a lot of time together, way more than we used to, I think. And I think the kids are sort of rediscovering each other as a family.
For those moments, this family is grateful after overcoming so much. Heather Urix West, Global News, Airdrie, Alberta.
And that is Global National for this Sunday. I'm Robin Gill. On this Easter, we leave you with a special concert. Andrea Bocelli gave a concert in an empty cathedral in Milan. It was live streamed to the many around the world who are locked down during these extraordinary times. Bocelli hopes the sacred songs will inspire all of us and help heal a wounded earth's pulsing heart. Thank you for watching. Good night.